Do you know how many people die from this every year, and what they would give to prevent it from happening to their loved ones, or even to themselves? So give me your full attention right now and acquire this life-saving knowledge to protect yourself and the people you care about. What if that strange tightness squeezing your chest this very second, the crushing fatigue that slammed into you out of nowhere, the breathlessness you just brushed off as nothing, what if that is your heart dying, quietly, irreversibly, while you sit there doing nothing? Yes, you saw the thumbnail and you're absolutely right. If any of this is happening to you, your body is in mortal danger. Act now. If it isn't yet, pay attention, because the next time it could be you, your spouse, your parent, your child, and hesitation could mean they never wake up. Heart attacks don't wait for dramatic music or warning sirens. They strike silently, stealing oxygen from your heart muscle second by second. Every minute you delay, more of your heart tissue dies forever. Ignore it just a little longer, and the life you take for granted, walking without gasping, laughing without pain, hugging the people you love, can vanish in an instant. Hundreds of thousands die every year in the United States because they waited, because they thought it'll pass, because no one told them exactly what to do when they're alone and terrified. I'm Dr. Choi Smith, a cardiovascular specialist who has spent over 20 years pulling people back from that edge, and right now I'm handing you the precise steps to recognize these hidden killers and survive, even completely alone, with no help coming yet. In the next few minutes you'll gain the power to protect your heart, limit the damage, shorten recovery dramatically, and keep living the full, active life you and your loved ones deserve. Stay locked in until the very end. I'm revealing the complete survival protocol that has already saved countless lives. It could be the difference for you next time. Sinta se a vontade para escrever sua cidade ou país nos comentários abaixo. E sempre grande prazer ouvir pessoas do mundo inteiro compartilhando suas histórias e experiências aqui no canal. And if this video just gave you the tools to potentially save a life, yours or someone close to you, hit that like button right now and subscribe to the channel. That simple action helps more people discover this critical information, and it means you'll never miss the next video with practical, evidence-based tips that could make all the difference in a health emergency. This isn't optional information. This is urgent. Your heart, and the hearts of the people you care about, can't afford to wait another second. Let's move. The signals we're talking about aren't loud, obvious alarms like you see in movies. They're quiet, sneaky, and that's exactly why so many people in the United States lose precious time, and sometimes their lives, every single year. A heart attack, or myocardial infarction, happens when blood flow to part of the heart muscle is suddenly blocked, usually by a blood clot forming on a ruptured plaque inside a coronary artery. Without oxygen, that heart tissue starts to die within minutes. The faster blood flow is restored, the more heart muscle you save. That's why cardiologists say, time is muscle. But here's the terrifying part most people never hear. The classic elephant on the chest, crushing pain only happens in about half of all cases, especially in men. For many others, women in particular, but also plenty of men, the warning signs are far more subtle and easy to dismiss. These are the most commonly ignored signals that your heart is in trouble right now. First, a vague discomfort or pressure in the center of the chest that lasts more than a few minutes, or that comes and goes. It might feel like tightness, squeezing, fullness, or heaviness, not always sharp pain. People often describe it as indigestion, heartburn, or just gas. Second, sudden, extreme fatigue that hits like a truck, even if you've been resting. You might feel so wiped out you can barely stand up or walk across the room, and it doesn't improve with rest. Third, shortness of breath without any obvious reason. You're sitting or lying down and suddenly feel like you can't catch your breath, or like someone is sitting on your lungs. Fourth, cold sweat breaking out for no reason, clammy, drenching sweat that feels different from normal perspiration. Fifth, nausea, vomiting, or a sense of impending doom, an overwhelming feeling that something is terribly wrong, even panic or anxiety that seems to come from nowhere. Sixth, pain or discomfort spreading to one or both arms, especially the left, the jaw, neck, upper back, or upper stomach. It can be subtle, just an ache or burning sensation. Seventh, lightheadedness, dizziness, or sudden weakness that makes you feel like you might faint. These symptoms can appear alone or in any combination. They can last minutes, disappear, then return stronger. They can build slowly over hours or days, or strike suddenly. Because they're so nonspecific, people rationalize them away. I ate something bad, I'm just stressed, I overdid it yesterday, I'm getting older, it'll pass. That delay is deadly. Studies from the American Heart Association show that the average person waits more than 2 hours before seeking help, and many wait much longer. Every 30 minutes of delay increases the risk of death and permanent heart damage significantly. Think about it, how many times have you or someone you know felt off in one of these ways and just powered through? That's exactly how this signal gets ignored, until it's too late. But once you know what to look for and trust your instincts, you can break that cycle. In the next part, I'll explain exactly what's happening inside your body when these signals appear, so you understand why acting fast is non-negotiable. Now that we've covered the subtle, often ignored signals your body sends during a heart attack, let's look under the surface at exactly what's happening inside your arteries and heart muscle, because understanding the mechanics makes it crystal clear why every minute counts and why hesitation can be so devastating. A heart attack occurs when one of the coronary arteries, the blood vessels that supply oxygen-rich blood directly to your heart muscle, becomes suddenly blocked. In most cases, this blockage starts with atherosclerosis. Over time, plaque, a mix of fat, cholesterol, calcium, and other substances, builds up inside the artery walls, narrowing them and making them less flexible. The crisis begins when this plaque ruptures. The rupture exposes the inner contents to your blood, triggering your body's clotting system to form a thrombus, blood clot, at the site. This clot can grow quickly and completely block the artery, cutting off blood flow downstream. Without blood, the heart muscle tissue beyond the blockage is starved of oxygen and nutrients, a state called ischemia. Within minutes, those cells start to die in a process called infarction, hence, myocardial infarction. The longer the blockage persists, the larger the area of dead tissue becomes. That dead muscle is replaced by scar tissue that doesn't contract like healthy heart muscle, permanently weakening your heart's pumping ability. This can lead to heart failure, dangerous arrhythmias, or sudden death. Here's why the symptoms we discussed are often subtle. The blockage may not be total at first, blood flow can fluctuate as the clot partially forms and dissolves. Pain signals depend on nerve sensitivity, which varies between individuals. In many cases, especially in women, the symptoms arise from reduced blood flow to other areas or from the heart's response to stress rather than direct crushing pain. Research from the American Heart Association shows that women are more likely to experience symptoms like shortness of breath, nausea, fatigue, or back/jaw discomfort instead of classic chest pain. The critical science fact everyone needs to know: time is muscle. Studies consistently show that the amount of permanent heart damage increases dramatically with each passing minute of untreated blockage. For every 30 minutes of delay in restoring blood flow, outcomes worsen: higher risk of death, larger infarct size, poorer long-term heart function, and greater chance of complications like heart failure or arrhythmias. This isn't theoretical. Data from major U.S. registries and the American Heart Association indicate that the average pre-hospital delay, from symptom onset to hospital arrival, remains far too long, often well over 2 hours, despite decades of public education. Many people wait because the symptoms don't match the Hollywood heart attack they expect, or they hope it will pass. But your heart can't wait for certainty. The muscle is dying in real time. Recognizing the science behind those quiet signals empowers you to act decisively before irreversible loss occurs. In the next section, we'll examine why the most common responses, waiting it out, self-diagnosing, or even driving yourself to the hospital, often make things worse, and why a simple, immediate protocol can change everything. By now you understand exactly what's happening inside your body when those subtle signals appear: a coronary artery is blocked, oxygen is cut off, and heart muscle is dying minute by minute. So why do so many people in the United States still lose critical time, or worse, when help is available? The most common responses people have when they feel these warning signs often do more harm than good. Let's look at why the usual approaches frequently fall short, and why having a clear, immediate protocol you can follow alone is essential. First, the biggest and most dangerous mistake: waiting to see if it passes. Maybe it's just indigestion, I'll lie down for a bit, it'll go away like last time. This delay is the single largest factor in poor outcomes. American Heart Association data shows that the average time from symptom onset to hospital arrival is still well over 2 hours in many cases, far beyond the ideal window where clot-busting drugs or emergency procedures can save the most heart muscle. Second, trying to self-diagnose or tough it out. Many people take antacids, drink water, walk around, or even ignore it completely because the symptoms don't match the dramatic chest pain they expect. By the time they realize it's serious, the damage is already extensive. Third, driving yourself to the hospital. It feels proactive, but it's extremely risky. If you lose consciousness or have a sudden arrhythmia while driving, you endanger yourself and others on the road. More importantly, you arrive without paramedics already on scene, meaning no immediate ECG, no oxygen, no IV access, no aspirin administration, and no advanced life support if things deteriorate en route. Paramedics can start treatment the moment they arrive at your home, often saving critical minutes. Fourth, relying on unproven or dangerous home remedies. Cough CPR, for example, has been widely debunked. It can actually cause harm and delays real action. Other myths, like pressing on pressure points or drinking water to flush a clot, have no scientific basis and waste precious time. Even when people do seek help quickly, conventional medical care, while excellent once you reach the hospital, depends entirely on how fast you get there. In the ER or cath lab, doctors can administer powerful clot-dissolving medications, thrombolytics, perform emergency angioplasty with stenting, or use other interventions to reopen the artery. These treatments are highly effective, but only if performed within the golden window, ideally under 90 minutes from first medical contact for STEMI heart attacks, and even faster is better. The reality, none of these hospital-based solutions can start until you take the first step. Waiting, self-diagnosing, or driving yourself puts that step off, and every minute lost is permanent heart muscle lost. That's why the protocol I'm about to share focuses on what you can do immediately, alone, in the first critical minutes, actions that bridge the gap, limit damage, and dramatically improve your chances before professional help arrives. In the next section, I'll walk you through the exact, evidence-based steps anyone can take the moment they recognize these signals, steps that have saved lives time and again. You now know the science. A blocked artery is killing heart muscle right now, and every minute of delay makes the damage worse. The good news is that you don't have to be helpless. There are precise, evidence-based actions you can take immediately, even if you're completely alone, that dramatically improve your chances of surviving with minimal long-term damage. These steps are recommended by the American Heart Association and major U.S. cardiology guidelines. They are simple, require no special equipment, and can be done in the first critical minutes while help is on the way. Step 1. Recognize the signals and trust your body, act immediately. Don't wait for classic, crushing pain or certainty. If you're experiencing any of the symptoms we discussed, chest discomfort, shortness of breath, extreme fatigue, cold sweat, nausea, spreading pain, dizziness, assume it could be a heart attack. Your instinct is usually right. The moment you suspect it, move to action. Delaying to see if it gets worse is one of the most common fatal mistakes. Step 2. Call 911 right away. Do not delay, do not drive yourself. Pick up the phone and dial 911, or have speed dial set up. Tell the dispatcher clearly, I think I'm having a heart attack. Give your exact address, unlock your front door if you can safely do so paramedics can enter quickly, and stay on the line if instructed. Calling 911 activates the emergency system, paramedics arrive faster, start treatment on scene, ECG, oxygen, aspirin if appropriate, for access, and transport you directly to the right hospital with a cath lab ready. Driving yourself wastes time and risks a crash if you collapse. Step 3. If you're not allergic and your doctor has previously approved it, chew and swallow aspirin immediately. Chew one adult dose, 325 mg, regular aspirin tablet, not enteric-coated or low-dose baby aspirin unless that's all you have. Chewing allows faster absorption through the mouth lining. Aspirin inhibits platelet clumping, helping to limit the clot's growth and improve blood flow. This simple step, taken early, has been shown in studies to reduce mortality and limit infarct size. Important, only do this if you have no active bleeding, recent ulcer history, or known aspirin allergy. Ideally discuss this with your doctor ahead of time so you know it's safe for you. Step 4. While waiting for help, get into the most comfortable position and stay calm. Sit or lie down in a semi-reclined position, like in a chair with feet up or propped on pillows, to reduce the heart's workload. Loosen tight clothing. Try slow, deep breaths to stay as calm as possible. Panic raises heart rate and oxygen demand. Do not eat, drink, smoke, or take other medications unless directed by the 911 operator. Preparation you can do today, before any emergency. Keep a list of your medications, allergies, and medical history visible, on fridge or nightstand. Have your phone charged and near you at all times. If your doctor approves, keep a bottle of regular 325 mg aspirin in an easy-access spot, bedside, kitchen, purse. Tell family or close contacts your emergency plan so they know what to do if they find you. These 4 steps, recognize, call 911, chew aspirin if appropriate, position comfortably, are the most powerful things you can do alone in those first minutes. They buy critical time, limit clot growth, and ensure professional help starts treatment sooner. In the next part, I'll give you a clear, step-by-step protocol checklist you can memorize or keep handy, so when the moment comes, you act without hesitation. You now have the 4 key immediate actions: recognize the signals, call 911 without delay, chew aspirin if appropriate, and position yourself comfortably while waiting. To make this truly automatic when panic might try to take over, here is the exact, step-by-step survival protocol you can memorize, print, or save on your phone, so the moment those signals appear, you move through it without hesitation. This protocol is designed to be followed in sequence, every time, even if you're alone and scared. Step 1. Stop and assess, trust the signal, 10 to 20 seconds. Pause whatever you're doing. Ask yourself, do I have any of these warning signs: chest discomfort, shortness of breath, extreme fatigue, cold sweat, nausea, spreading pain, dizziness? If the answer is yes to even one, assume it could be a heart attack. Do not wait for more symptoms or for it to get worse. Your body is giving you the only warning it can. Move immediately to Step 2. Step 2. Call 911, activate help now, 30 seconds. Grab your phone, keep it within reach at all times. Dial 911. Speak clearly and calmly. I believe I'm having a heart attack. My address is, your address? Stay on the line if asked. While speaking or right after. Unlock your front door if you can walk to it safely, so paramedics enter without delay. Turn on an outside light if it's dark. This one call starts everything: paramedics, ECG on arrival, hospital notification. Step 3. Aspirin, if cleared by your doctor, 30 to 60 seconds. If you have previously discussed this with your doctor and have no contraindications, active bleeding, recent ulcer, known allergy, chew and swallow one regular 325 mg aspirin tablet immediately. Chew it, don't swallow whole, so it absorbs faster through your mouth and stomach. This helps thin the blood and limit clot growth. If you're unsure or don't have it handy, skip to Step 4. Calling 911 is still the most important action. Step 4. Position and calm, reduce heart workload, ongoing until help arrives. Sit down or lie back in a semi-reclined position, recliner chair, propped up with pillows on a bed or couch. This eases the heart's pumping effort compared to lying flat or standing. Loosen any tight clothing around your neck or waist. Breathe slowly and deeply, inhale for 4 counts, exhale for 6, to stay as calm as possible. Do not walk around, eat, drink, or take other medications unless the 911 dispatcher specifically instructs you. Quick preparation checklist you can do today: 5 to 10 minutes. Program 911 into speed dial on all phones. Place a note with your address, key medical info, medications, allergies, doctor's name, and emergency contacts in a visible spot: fridge door, bedside table. If approved by your doctor, keep a fresh bottle of regular 325 mg aspirin in an easy spot: bedside, kitchen drawer, car glove box, purse. Tell at least one trusted person your plan so they know what to do if they find you unwell. What to expect after you call: paramedics usually arrive within minutes in most U.S. areas. They will perform an ECG, give oxygen if needed, start and administer additional medications, and transport you to a hospital equipped for emergency heart care. Acting fast with this protocol means they start treatment sooner, you arrive with critical information already gathered, and your chances of full recovery skyrocket. Memorize this simple sequence: assess, call 911, aspirin, if okay, position and calm. Practice it mentally a few times today. It takes seconds to run through when it counts. In the final chapter, I'll wrap everything together with encouragement and your next immediate actions to make sure you're truly prepared. You've now seen the full picture: the subtle, life-threatening signals your heart sends when it's in crisis, the science of why every second of delay kills more heart muscle, why waiting or common mistakes cost so much, and the simple, powerful steps you can take immediately, even completely alone, to survive with your heart as intact as possible. This isn't rare medical knowledge reserved for doctors. This is essential information every single person in the United States should have, because heart attacks don't announce themselves in advance, they strike when you least expect it, often when you're alone. The protocol is straightforward. Assess the signals and trust them, call 911 immediately, chew aspirin if your doctor has approved it, position yourself comfortably and stay calm. Prepare ahead, keep your phone charged, medical info visible, and aspirin accessible if cleared. Thousands of lives are saved every year because someone acted fast with exactly these steps. You can be one of them, or the person who helps save someone you love. Your next move is simple and urgent. 1. Talk to your doctor this week about whether aspirin is safe for you in an emergency. 2. Set up your emergency plan today, program 911, place your info where it's easy to find, keep aspirin handy if appropriate. 3. Share this video with the people you care about. One share could save a life. If this video has given you clarity, confidence, or even just a wake-up call to protect yourself and your family, I'd love for you to take 2 quick actions right now. First, hit that like button. It tells YouTube to show this life-saving information to more people who need it, and it helps spread awareness that can truly make a difference. Second, subscribe and turn on notifications so you never miss future videos with practical, evidence-based health tools that could protect you or someone you love in an emergency. And while you're here, drop a comment below. What's the first step you're taking today? Talking to your doctor, setting up your aspirin, or sharing this with family? Or just share your city or state. It's always inspiring to see where everyone watching is tuning in from across the country. Thank you for staying until the end. You just invested in something priceless, the knowledge and power to act when it matters most. Your heart, and the hearts of the people you care about, thank you. Act on any unusual signal. Time saves lives. I'll see you in the next video. Take care, stay prepared, and stay safe.